Okay, I have someone who asked me a question about blood pressure on YouTube. So I'm going to answer the question, but first let me read it to you guys. I'm excited I came across your channel. I'm a new nurse to dialysis and I'm still struggling with what to do for a patient when the blood pressure elevates and or tachycardia. Can you provide a few tips based on what you know? That would be nice. That would be a nice video as well. Thank you. Okay, so if a patient has high blood pressure, well, first, okay, I'm gonna make this really short, okay, because I can talk for a long time about this. Okay, patients are normally told not to take their blood pressure medicine before coming to treatment. So you're gonna experience a lot of patients with high blood pressure upon arrival to dialysis. And what I usually do is I'll ask them to bring their blood pressure meds with them because sometimes the medication that we have in center is just not going to cut it. So I tell them to bring their blood pressure medication with them. And if it's that time of the day where they're supposed to take it as prescribed by their nephrologist, I ask them to take their medicine opposed to taking our medicine. Now, if they don't have their blood pressure medicine with them, I follow policy and procedure in nephrologist orders and I give hypertensive medicine as needed. Normally, in our particular clinic, our nephrologist does not want us to give blood pressure medicines right at the beginning because, as you know, when people are on a machine, the blood pressure naturally will start to come down. So, if they take blood pressure, for some patients, if they take blood pressure medicines and then get on a machine, then they're going to experience such a drop in blood pressure that they're not going to be able to get a good dialysis treatment, therefore, having inadequate dialysis. Now, let me stop there with that explanation for hypertension. And for those with tachycardia, if tachycardia is usually followed with hypotension, then that usually means that the patient may be a little dry and or you're taking off too much fluid for that particular patient during treatment. So what's the opposite of removing fluid? You want to now kind of hydrate them back. So per policy and procedure, per nephrologist orders, you would give the recommended amount of saline, and usually that will help regulate the blood pressure and the pulse rate. I also get orders and get the okay to apply oxygen because oxygen will also help the heart work less and it will also help with that tachycardia in some cases. So I hope that helps. I can get more in depth with it, but then it can be kind of a lot and can be kind of confusing.